We're talking about your vestibulo-ocular reflex and how we use that testing to differentiate supranuclear from infranuclear palsies. So the vestibular system is part of your vestibular cochlear system. That's the eighth nerve, but this is the balance part of the vestibular cochlear system, and it's got to talk to the ocular motor nuclei in your brainstem, and that's completely reflexive. You don't need any conscious effort to do that. And the reason you need it is every time you tilt your head, you have to have counter rolling to maintain the vertical alignment of the world. So when you tilt your head, or if you're riding on a motorcycle, you have to have counter rolling, and that counter rolling is produced by input from the vestibular system in your ear. So that counter rolling is what we call the vestibular ocular reflex, a reflex in response to head rotation, to keep the eyes aligned on the target. You don't have to think about it, it just happens by itself. And so we can take advantage of the vestibular system talking directly to the ocular motor nuclei. And so for the pons, that's the sixth, and for the midbrain, that's the third and the fourth nuclei. And so the eighth nerve talks to the brainstem, both to mediate horizontal movements and also vertical movements in response to head rotation and the effects on this semicircular canals. And so the vestibular system talks to the ocular system in the brainstem, and that is a reflex. And the way we can use this is called the doll's head maneuver. So if someone can't look to one direction, either horizontally or vertically, we can rotate their head passively, and that will initiate the vestibular ocular reflex. And if we can overcome the movement with the doll's head maneuver, then we know that everything below the nucleus is intact. So if the person can't look to the right, but we can make them look to the right with the doll's head maneuver, then we know the nucleus, the nerve, the neuromuscular junction, and the muscle are all able to move the eyes, but the supranuclear control telling the patient to look to the right have been disrupted. And so if we can do the doll's head on the patient by rotating their head passively, and if their eyes move, that tells us that the problem is supranuclear. And that's really important in patients who have ophthalmoplegia, who we can't tell where the lesion is. The most prominent is a down-gaze palsy in progressive supranuclear palsy, where we'd like to establish that the reason this person can't look down is a supranuclear problem, but also in problems that are arising from the cortex and the frontal lobes or the parietal occipital temporal region, where it's a saccade problem or a pursuit problem, and it's clearly cortical, and everything from the brainstem down is intact. So you need to know a little bit about this reflex, the vestibular ocular reflex, and how we use it with the doll's head maneuver to overcome ophthalmoplegias and define that the problem is supranuclear and not infranuclear.